Hey everyone, welcome to Medical Interview Simulation in English. Today, we're going to practice medical interviews based on questions from the Japanese National Medical Examination. We'll turn these exam questions into real-world conversations between Dr. Satomi as the physician and Umi Yamazato as our patient. I'm Yamato, and I'll be your guide through this practice session. Our goal is to help healthcare professionals get better at talking with patients through these realistic scenarios. Alright, for today's practice we're using a case from the National Medical Exam. We'll see how Dr. Satomi handles this consultation with Umi-san.
Hello, Yamazato-san. I'm Dr. Satomi. What brings you to see us today?
Well, I was referred here because I haven't been eating well, and there's something about my kidney numbers being high.
I see. Could you tell me more about what's been going on with your appetite?
It started about 2 weeks ago. I just don't feel hungry anymore. Food doesn't taste bad. I just don't want to eat much.
How has this been affecting your daily meals?
I'm probably eating only half of what I usually do. My family is getting worried.
That must be concerning for you and your family. Have you noticed any other changes along with the decreased appetite?
Well, I've noticed that 2 of my toes on my left foot have turned kind of purple lately.
Thank you for mentioning that. When did you first notice the change in your toes?
Just recently, maybe around the same time as my appetite problems started.
I understand you've had some heart procedures done before. Could you tell me about those?
Yes, I've had stents put in 3 times. First about 10 years ago, then 3 years ago, and the most recent one was just last month.
And you're taking some regular medications?
Right. I've been on medicines for high blood pressure, cholesterol, and uric acid for about 15 years now.
Have there been any recent changes to your medications?
No, they've been the same for a while now.
How about any pain or swelling in your legs?
No, my legs feel fine. Just those purple toes I mentioned.
Let me make sure I understand everything correctly. You've been experiencing loss of appetite for about 2 weeks, eating about half your usual amount. You've also noticed purple discoloration in 2 of your left toes. You had a stent placed last month, and you're on long-term medications for blood pressure, cholesterol, and uric acid. Is that all correct?
Yes, that's exactly right.
What concerns you the most about these changes?
I'm worried about my kidneys. The doctor who referred me mentioned something about my kidney numbers getting worse.
I appreciate you sharing all of this with me. It's good that you're getting these changes checked out.
Let's pause here and notice how Dr. Satomi used several key techniques. She started with open-ended questions, showed active listening with supportive responses, and provided a clear summary at the end. She also naturally incorporated the patient's medical history while maintaining focus on the current concerns. And that's a wrap for today's medical interview simulation in English. Thanks for practicing with us, and we'll catch you next time. Hey, if you want to check your answers, head over to the National Medical Exam question 1 D42. That's where you'll find all the details.